Okay, appendicitis. As you can tell from the name, it's inflammation of the appendix. The appendix is a little blind-ending pouch at the beginning of the colon. And as most inflammations of little tube or little pouch-like things like this, it arises from obstruction. So in children, it can be due to lymphoid hyperplasia. So just the lymph glands grow too big and can cause compression and obstruction. Or in adults, you can have a fecalith. A fecalith is like a super hard, dry stool, and this can cause an obstruction. You have a little hard piece of poop here, causing obstruction. And so pathophysiology is similar to all the other pathologies with obstruction leading to infection. For example, stuff like cholecystitis, blah blah blah, maybe diverticulitis sometimes. What happens is you get stasis of retained mucus, okay? Because if obstructed, is not going to be able to leave. So then now you have this fluid, this swamp fluid, because it's not moving. You're going to get bacterial overgrowth. Then it's going to lead to infection, inflammation, edema. And then now you're going to have increased pressure, you're going to have distension. And you have all these blood vessels on the outside. Those are going to get compressed because you have all this increased pressure. So now you're going to get decreased blood flow, venous outflow. You're going to get hypoxia, ischemia, necrosis. Okay, so now you're in bad shape. Now your appendix is like dying. Okay. And then if you leave it too long like this, now you have a weakened wall because of the necrosis. You have increased pressure still. So eventually you're going to rupture. You're going to rupture all your contents out. So we're in the appendix here. Now we've ruptured our this gross inflammation stuff out into the peritoneum. Remember, this is all happening in that peritoneal sac. Okay. So now you're going to get inflammatory fluid and bacterial contents into the peritoneal cavity. Now you're going to get peritonitis. Okay. So how does this present? The key thing the way this presents is diffuse periumbilical pain that's going to migrate to the McBurney point. McBurney point is right here that I've circled. It's between the right anterior superior iliac spine and the umbilicus, and it's 1/3 of the way from that point. Okay, the other symptoms you can get are nausea, loss of vomiting, loss of appetite, and fever. Okay, but it's right. The key thing here is that diffuse periumbilical pain that moves to the right lower quadrant, the McBurney point, and you can have all these associated GI symptoms. Again, like I told you, if this pain is early on, it happens earlier on. If you don't do anything about it, eventually you're going to get rupture. You're going to get inflammation of the peritoneum, which leads to peritonitis. Now, what signs on physical exam would you see with peritonitis? This is maybe less step 1 oriented and more real life oriented. The physical exam findings that indicate peritonitis, which is real bad, is guarding, which is they're already tensed up because there's inflamed everywhere. They don't want to hurt. And rebound tenderness. That's when you push in, you let go, and it hurts more when you let go than when you're actually pushing in. Now, further additional information that you might not need for step 1, you can stop at this point. I'm done talking about appendicitis. But the reason why you get that diffuse periumbilical pain and why does it migrate to the McBurney point is that first you start with a visceral pain. Visceral pain is dull, it's non-localized, and it's due to the distension of this appendix lumen. Okay, this visceral pain is stuff inside the peritoneum. Now, as the appendix becomes more and more inflamed, it's going to irritate the parietal peritoneum that's right around it. Okay, the parietal peritoneum has a somatic innervation, so it's going to cause a more localized somatic pain, and the pain is going to, again, it's localized. It's going to be where the appendix is. Appendix is the right lower quadrant, and it's going to be at the McBurney point. So that's why you get a change from that diffuse periumbilical pain to that McBurney point. So that's it for appendicitis.